Hey, everybody, and welcome to the Dr. Mom Show. I am your host, Dr. D, mom of three. Thank you so much for joining us again, whether you're listening or checking us out on our YouTube channel. Thank you for taking time out to listen. We have a great show in store for you today. I have somebody who's awesome. He's so much fun to talk to. You're going to love his accent. You know, I can just listen to him talk. And then his story is just so enticing, inspirational. I mean, you're definitely going to leave here changed when it's all done. Again, before we get into the show, if you've missed any of the previous episodes, make sure you get those down because there's always an expert on here, whether myself or somebody else, dropping some great nuggets for you of how you can improve your life, whether physical, mental, or emotional, or even spiritual. And then, of course, how to impart that into your family. And again, here on the Dr. Mom Show, this is an informational medical resource. It does not take the place of your physician or your child's physician. So definitely make sure you get your treatment plans, your diagnoses, and any differentials from your physician or your child's physician. Well, ladies and gentlemen, today I am so excited to have Mr. Paul S. Rogers on the show today. Woo! And he's Paul S. Rogers because he said there's so many Paul Rogers out there that finally he gets the opportunity to use his middle initial, right?
Do you know, I feel kind of sorry for the rest of the planet because one of me is kind of bad, but just imagine hundreds. That's the sort of thing that keeps me up at night.
I love it. Well, let me tell you a little bit more about Paul. He is a transformational expert, highly entertaining keynote public speaker and coach. He's a trauma and traumatic brain injury and PTSD mentor. He's also, and he'll get into this, a train crash and cancer survivor. In addition to all of that, he has lots of time to be a podcast host of his show, Release the Genie. He made belly dance for us, so you better get on to see that. And a best-selling author and awareness ties ambassador and columnist. He started as a commercial lawyer, but now he's a kite surfer to a teacher on First Nations Reserve to now. His goal is to inspire others to be their own real life heroes, which we love here at the Dr. Mom Show, and helping others turn their adversity into hope, opportunity, and prosperity. Help me welcome Mr. Paul S. Rogers again. Yeah. Snap, 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 snap. Thank you again for taking time out to talk with us.
It's welcome, and it's always so much fun to just talk with you anyway. So I'm very excited about where this is going to go because neither one of us knows, and it's kind of cool.
That's right. Well, we're just going to dive right in. So I'm sure everybody's thinking like, oh my gosh, lawyer, kite surfer, what is this? So you started as a lawyer. What happened? How do things lead to kite surfer, so on and so forth?
I mean, I certainly didn't look like this when I was a lawyer. I don't think I would have attracted the right client to the commercial. So buzz cut, the whole 9 yards. I was a lawyer for 10, 11 years. And I just found that even though I was financially wealthy and successful, that I was stuck and I was just super empty inside. So I decided that actually I needed to stop thinking with my head because my head had got me all the way through the normal things: high school, college, university, law school, and it got me to where it was, but there was no happy ever after. So I then decided that actually I would do something which my heart actually wanted, and that I had a hobby which was kite surfing. I wasn't even particularly good at it, but I really, really enjoyed doing it. And so I made the shift from the head to the heart. Now, there were some similarities in that I wore a suit, 3-piece wetsuit, and I went to board meetings every single day. So there were some similarities.
That I love that. And I think I will say, as professionals, I think sometimes we forget how to have fun. You get so caught up. Like, it's so funny. I saw you counting, I went to like regular school, then I went to college, and you go to law school. And what was funny is my babies just graduated pre-K, and moving up in the world. And they said, we were talking about school, and I said, mommy and daddy, we went to regular school. I was like, you're gonna start kindergarten, and we counted to 12. And he said, then you get to go to college. And I'm like, then you get to go to medical school if you be a doctor. And then you get to do residency. And they were just like, their jaws just dropped. And it was funny as I did that. It was like, oh my goodness. At this point in my life, more than half of my life I've spent in school learning. And, and I'm not saying that to give up your profession, unless it's something like where Paul, you're able to transition completely fine. But I think at the same time, just always remember to have a good time, especially if you have a family. Don't forget to have a good time and put on a wetsuit. And that's symbolic. I'm saying that symbolically. Not everybody needs to be a kite surfer, but don't forget to put on your wetsuit and do something fun and something that's out of the ordinary for yourself.
And my friends, most of them are still lawyers, and they now look at me and they say, wow, lucky you. That at the time they just thought I'd gone crazy, but now they're like, I wish I had the courage too, but then they're too far into the system, the machine, to actually come back out. So I think what's happened is natural things and thinking. No one actually, I didn't start off thinking, I tell you what, I'm going to do this, I'm going to quit and be a kite surfer. No, that never ever entered my mind until it was the right time, and then it entered the right mind. So I don't regret any of the things I've done. It's just that was my calling changed, that's all.
Yeah. And it does. I mean, as you transition through life, you think you're going straight to the right, but sometimes you make a right, left, back to the right. I mean, that's just how life works. So definitely roll with the punches, as they say. So as you know, today we're talking about getting to the bottom of traumatic brain injury. And Paul was kind enough. He's undergone a traumatic brain injury himself. So we're going to go into that, not only to hear his story, but of course, because I'm a physician, but to also just share some things that whether you or a family member or somebody close to you have been through one, because traumatic brain injury is way more severe than a concussion. But I'm using a concussion as an example because I think sometimes people overlook a concussion and say like, oh, I'm going to be okay. I'm going to go away. It's going to go away. So we just want to give you that information that you need to be more mindful and insightful about anything if anything happens. So tell us, Paul, how did you end up sustaining your traumatic brain injury?
Well, I took a fairly dramatic route to it because I tend not to do things half-hearted in life. My wife and I and my 2-year-old in 2018, we were driving back in North Quebec, lots of snow in March, and we picked him up from daycare, coming back over an unmanned railway crossing when a train struck the car and it T-boned the car, took us down the track, destroyed the car and also us. My wife and I were to wake up 10 days later, having been in a coma and then put into an induced coma. And the labels they come later because at the time it's just a catastrophic injury. And I love the point you raised about the concussion, because people say, oh, it's a mild one. Well, a brain injury is a brain injury. And to think one is bigger or less than the other is all measured by a medical scale, the Glasgow scale. And that is how they grade it. But the injury was catastrophic. I mean, my wife, when we arrived at the hospital, was actually more severe. She had to have a large part of her skull removed, in the frontal lobes to let the swelling, because mine was in around the back and the side of the head. They couldn't do that because I actually had caught the carotid artery, so they couldn't actually go and do things like that. So they just had to let me swell up. So I turned into this little Stay Puft Marshmallow Man. So they only really realized when the swelling started to go down how much of the damage and injuries were. And we both have severe traumatic brain injuries, and we haven't recovered. We just got to a stage where we're on our journey.
And, I think that's so important. So if you're wondering, like, what is a traumatic brain injury? So essentially that is any trauma to your brain. So whether it's a blow, like if somebody hits you in the head with a bat, if you're in a car accident, or in this case, something that happens rarely with a train, if a gunshot to the head is another one that we see. And there's 3 classes. So there's mild, which we usually categorize as a concussion, because normally over time patients do okay. And then obviously there's moderate, and then there's more severe, which, like Paul was giving the example. So those are the 3 things we're looking at. And again, people don't realize it. They really do take it for granted. Even with falls, traumatic brain injuries can be missed with falls, especially in the elderly population. A lot of times if somebody breaks their hip, you're more focused on getting the hip fixed and not necessarily looking at, oh, they hit their head, they didn't lose consciousness, they must be fine, everything must be good. So that's what we're talking about. That's what we need to focus on, and what we want you to get during our conversation to see, like, if you've been through anything like this, if a family member has been through anything like this, and we'll talk about some symptoms and things like that, that if that triggers anything, that you're like, hey, I probably need to get checked out.
The big problem is it's invisible. If you break your arm, it's very visual, or so you've got a sort of enclosed box, and you don't actually need to hit the head. A whiplash injury where you actually
right.
And I know in domestic violence it's a very much that it strikes to the head don't leave particular bruising. So, and addiction, so there's so many ways. And there's an ABI, which is acquired brain injury, which is what people with strokes, people who have a lack of oxygen. So TBI is kind of a subcategory of that. But you're right to say that there's people really, they can't leave it. They must, because there's certain things. I mean, first of all, it's your central processing system. If you spilt water on your keyboard, your first thing you do is go and shake it and check it. The central motherboard has actually been damaged and you can't see it. But if you don't check it, it can lead to actually death if you don't catch it properly, because a blood clot up there, that's an aneurysm. So it's something you have to take very, very seriously. And the fact that you may not have passed out does not give an indication that it's not still a brain injury.
Yes. And that's so true, because even sometimes in concussions, we see that too, that we see that people have, like a mild, quote unquote, a mild concussion, mild symptoms, no nausea, vomiting, no change in memory, but maybe like a couple days after, all of a sudden those symptoms show up. So I agree. And then if you do have trauma to your brain, like Paul alluded to, sometimes the swelling may not occur right away. Like if you've ever hit yourself, or if you've ever hurt your ankle, and you're like, oh, that's going to be swollen tomorrow, you're going to feel it tomorrow, because that inflammation doesn't really kick in right away. It's not instantaneous. And some things to remember is when people have a traumatic brain injury, this is something that most people have to live with the rest of their lives. A lot of people, it's long term. And according to the CDC, I mean, it's almost broken up into quarters. So approximately 22% of people die. It's that severe that people die from their brain injury. 22% say about the same. 26% go on to improving, and then 30%, which is more than all of those, continue to get worse, especially if they don't undergo therapy or treatment, the appropriate measures that they need to undergo. So just from these numbers alone provided from the Centers for Disease Control, you can tell that this is serious. This is something that nobody should take lightly. And one thing, especially when patients come to me, if it's a follow-up for a car accident, my first question is always, did you go to the emergency department? Because I know a lot of times people are like, oh, I'm fine. You know, Paul again brought up whiplash, like just whiplash, because you don't realize that when your head goes like that, the pressure that goes into the front of your head and then into the back. And funny enough, we have a term for that. It's called contra coup is what it's called. And then some people get like raccoon eyes, because if your head goes forward that much, and we know that that's what happened, like just by seeing a patient, we can tell that that's what happened. So again, so important to know this. And Paul, I know obviously, you know, you had your son. I mean, did your son lose consciousness or anything? How did he do after the accident?
He was miraculously not injured. He had a little scratch on his forehead, so you look like Harry Potter, the child who lived. The big reason being is I had a great white husky Malamute, and the firefighters told us that on the impact, he jumped over the back seat to land on my wife, who was sitting in the back, and my 2-year-old. And if he hadn't done that, they would have certainly been killed outright. So he gave the ultimate sacrifice, and he saved their lives. So he's a hero. And I tell that story just to show that even in the depths of something so tragic, so destructive and you know, horrible, that there is an opposing act of love, beauty, and kindness. But you have to be ready to look for that, because that is not an obvious thing. But in that, a hero and a true act of love took place.
Oh, that's amazing. I mean, that is definitely only a miracle that in such a substantial accident that he was okay. And just those senses, you know, you hear those stories all the time that something happens and an animal, whether it's an animal or sometimes even a child, you know, who you think, you know, when kids are like, they're not listening, they don't know what's going on. But just that in that moment, they're able to act and react in a split second, essentially. So tell us, I'm sure after the traumatic brain injury, and again, it's not only Paul who underwent it, his wife also, and they've had to readjust their lives, you know, acclimate to it. And I love how Paul brought up that, you know, essentially you're taking it step by step, because they could have said, you know what, we have these brain injuries, life stinks, you know, we got dealt a horrible card. But I love, if you get to know Paul, and I encourage you, we'll give you information to like follow him and check him out, connect with him. I encourage you to do it, because it's always so uplifting to meet resilient people. Because just to be honest, out there, most people aren't resilient. I'm just saying. so so it's very nice to meet resilient people. So tell us, how did life change after having the traumatic brain injury, not only for yourself, but your family?
Everything changed. First of all, when I woke up, I didn't even know I had a family. And so I didn't know if I had anything left. And we both, my wife and I, have had the witnessing our own deaths in our own lifetimes. I mean, I was given a 7% of surviving. I passed over to the other side 4 times. So we had to relearn our boundaries with each other, because they changed our characteristics. And it was very hard at the beginning, because we didn't understand each other. Our little boy, we couldn't see him for 6 months because we were too ill, and we didn't want to frighten him. And so he stayed with my sister-in-law, and she's a child psychologist. How cool is that?
That worked out.
Well, you know, that was good. I tell you, there's some really amusing things from the universe. You'll like this. We'll get to that a bit later. But we had to relearn, and she became my caregiver because I became the more injured party.
Mm.
But what was happening was the medical profession were treating us as individuals. And so what they obviously didn't look at, because it's not particularly how they look, is the effect they have on the family unit. I mean, my wife was my chief caregiver. I was in and out of hospital, unconscious, and backs of ambulances, and she was barely functioning herself. And we did have a network, but that puts a huge amount of pressure on the family unit. Now, the good, because I always like to look at the good as part of it, because it's very easy to get on the blame and the negative train. The good part is that we are the stronger, we're more loving, we have such a deep respect for one another, which most people don't survive that, what happened to them. And what it's actually done is we and my son, we are such a tight, loving unit that that for me has been an absolute gift.
And I love that, because imagine that you're trying to just think of a movie, think of like a Lifetime movie. I feel like this is a movie. As Paul talks about this story, it's so like surreal to me that you almost feel like you're listening to a script of a movie. But can you imagine where someone's like, some of their personality has changed? Because when our brain's affected, how again we react, how we act, things we like, things we don't like. You're trying to think about things you've done. Paul brought up that, he couldn't even remember that he had a family initially and like what was going on. So imagine that he's not even doing that as an individual. His wife is also trying to catch her bearings too, in addition to take care of him. And I just want to use this moment to make you realize, when a woman has a cold, she usually doesn't complain. But when a guy has a cold, he complains on the side.
Don't tell him all our secrets, man. We've got to keep some
I had to slide that in there.
No, it was, I received that with love, so don't worry.
I know you do. That's why I said I feel comfortable saying that with you as my guest here. So because I know you would not take that, be offended by that, and I'm not. I'm just joking around.
But see, the thing is,
but yeah, we need to remember, like you were saying, during these situations. It's so easy just in life in general. When you wake up, I mean, it's so easy to say like, oh, I'm so tired, I got to go into this job. But imagine that you have to wake up, and you not only have to get up and physically get out of bed, but you also have to mentally, you have to make a deliberate effort with a traumatic brain injury to say like, I have to deliberately like get my synapses in my brain going and connecting and bringing my memories back too. And that's a lot of effort.
It is. And we both have damaged brains. There are large chunks which don't work like they used to. We're very high functioning people, which actually that kind of counted against us, because you walk into the doctors and they say, how are you doing? You're, oh, I'm fine. You're like, really? Yeah. I mean, really? And so it's been a journey. And I did a talk last week, and it was at the National Canadian TBI Association, and my talk was to the medical profession. And they asked me, be nice, and I'm always nice. So what I basically have encouraged them is to use what I've been through as a resource, as something to help with what can be done better. Are there any sort of bits? And so I want to give back, and that's been really from the start. I'm going to tell you one last romantic story, because I know you'll like this. My wife woke up the day before me, and she asked to come down and talk to me at my bedside. I was still out of it. So she came down, she talked. She then went back to her room. Now, my parents had already got the call, and they were flying from England to Canada to turn my life support off. So they arrived to turn it off, and the ICU workers ran and hugged them. And they said, his wife woke up yesterday. She went to talk to him. I don't know what the heck happened down there, but he's awake. So we
Oh
didn't
my
change his
goodness.
meds. You know why you're here. So we're going to call that a miracle.
That's right. That's right.
So
That's right. And it happens even as a physician, I believe those of you listening, I believe in God, he's a great physician. I just believe that God as a physician, he gives us the wisdom. Like when I wake up, I always ask for God to help me, to give me the direction, the wisdom, that as people speak to me, as I take care of my patients, that he helps direct me to make the best decisions, to come up with their diagnosis, to help them to be the best doctor I can be. And it's true, miracles happen. I mean, I've seen where people, you literally think you're like, this is it. Like they're not even going to make it through the night and just come back. And I know even with COVID, irregardless, there have been millions of deaths. There have been people who come into the hospital that you're just like, there's no way. And then they turn around and they walk out of the hospital. So I believe it, yes. But what a beautiful story. And, I love it because what a story of hope, that just never give up. And I think there is something special. And there's lots of articles out there and research about if a family member or a loved one is in a coma or unconscious, that you should still talk to them, because a lot of times subconsciously they are hearing you and they know what's going on.
it's very powerful, because what it shows me is we only understand a fraction of actually what the forces are, and what, as you said, where people like you, okay, you have your training, but there's something else which takes over and makes the medical profession, they do it because they love doing it. They don't do it because they want to be millionaires. There's other jobs they can do to do that. But
That's right. Amen.
yeah, but they do it because they want to heal and they want to care for other people. And I must admit, I've got nothing but praise for every doctor, and I've seen a few. I've got 7 on my team. I started with 15, so the other half are alive still. They're just doing something else. To make that clear. But no, it's a team effort, and that's when you need a excellence across the board, because all of them have got to link up.
Well, I love that. Just from the medical community, thank you. I mean, it's always nice to hear that. Sometimes we get a bad rap, but out there, I think overall, we do truly care. Our goal is to ultimately, we take an oath to do no harm and to do our best. So, I think overall, the majority of us, let's see, no matter what, there's always good and bad. So I can't say 100%. So with that, as you guys know, we've started the empowerment challenge. Empowerment. So as you know, we have 3 topics that Paul can choose from. And Paul, those topics are reclaiming your identity, mastering parenthood, and re-identifying your God-given intuition. And you can pick any one of those and just comment on something to encourage and empower the audience.
I'm going to pick the reestablishing our identity, because I've had to build my identity from ground zero up. And so is my wife, so is my family unit. It's not easy, but actually, to be honest, I've found that when it's not easy, it's a lot more of a sweeter prize. And we have that within us. We have the medical profession, but we also have a lot of strength inside. If you think you're beat, you're beat. If you think you're not beat, you're not beat. And so
That's right.
It starts inside, and you don't have to, if somebody says you've got something, you don't have to assume that identity. You are not your job. You are not your friends. You are not the body you showed up in. You are you. And that is the identity you need to get back in touch with. Not all the stuff you think you have, but you. That is the real you.
So powerful. And I think in this day and age, so important, because with social media and things like that, people forget who you really are. And we try to be other people. We get uncomfortable in our skin. You need to be comfortable with who you are and just be who you are. Love yourself and, do what you want to do, be what you want to be. Well, I love that. I hope you guys have enjoyed. I know I've enjoyed my time with Paul. Paul, the audience, how can they connect with you?
Absolutely. My normal sandbox I play in every day is LinkedIn. So Paul S. Rogers, because there's hundreds of other Paul Rogerses. I don't like that type of thinking, but keeps me awake at night. And also my website, new website, so go and check it out, is www.paulsrogers.com.
And just so you guys know, stands for special. So it's Paul Special Roger. That's what it stands for.
I like that. I'll take that. It's better than Steven, so I'm going to go with that one.
Well, thank you so much again. Thank you guys for listening. Of course, don't forget to follow the Dr. Mom Show on the YouTube channel. And then if you want to follow on Facebook, Dr. Mom Show, and of course on Instagram at Dr. Mom_show. Feel free to join my female group called Fulfill Females. Every week there's a challenge just to keep you uplifted and empowered and just be around a tribe who can just encourage you. And then Paul, again, I just want to say thank you so much for sharing your story and taking time out.
You're welcome. I love the work you're doing. So don't stop.
Thank you. You either. Don't forget to check out Paul's Genie show. He didn't get to belly dance today. Maybe next time.
I don't want to get rid of your viewers. Unsubscribe.
And of course, you guys don't forget to pre-order, I should say, your copy of Dr. Mom's Ultimate Guide. You can get that on my website, drdelenemushelak.com. And of course, remember, life is precious and priceless. You are amazing, and you can do anything you put your mind to because you are a superhero. Like even Paul said, that everybody to realize what a hero they are. And of course, just have faith over fear. God bless. And like Dr. Mom always says, don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. Thank you all. Bye.